Well, hello, Dr. Brotto.
Hi, Natalie. Good to see you.
Great to see you. Thank you so much for making time for us today. I'm
My
so
pleasure.
excited to talk all things sexual health, aging, and wellness with you.
Great. Me too.
And so, just off the top, high level, based on all of your research and expertise, what would you say or how impactful is mindfulness for women at this stage of life and their sexual health?
Yeah, excellent question, Natalie. First of all, let's define mindfulness. Mindfulness, people might be familiar with meditation, which has existed for millennia. And we tend to think about meditation as being associated with sitting in a lotus pose, maybe in a cave. Many hours at a time go by as we strive for enlightenment. And mindfulness is the secular adaptation of that. So it's not tied to any religious practice. And it's quite simplified in terms of the instructions, where what we are doing is we're practicing present moment, non-judgmental awareness. And so if we're listening to a mindfulness guide, the instructions would maybe guide us to focus on different parts of the body as well as the breath. And while we're paying attention to those sensations, we're practicing non-judgment and compassion. So the last 20 or so years, this has been the focus of my own research. And I've been very interested in, first of all, trying to answer the question, if we deliver mindfulness-based interventions to women with sexual problems, will they do it? Do they see this as something desirable? Is it feasible for them? Are they satisfied with it? And the answer to all of the above is yes. And then when we look at efficacy or how well does it work, there have now been quite a few randomized clinical trials comparing, say, 8 weeks of mindfulness to either a control group or 8 weeks of education alone or other kinds of therapy. And when it comes to midlife women, particularly with low desire, which is very common at midlife and through the perimenopause, the efficacy or how well it works is extremely high. And so we see significant improvements in sexual desire, significant reductions in sexual related distress. And these improvements are retained a year later, which is about the longest amount of time that we follow up women in our clinical trials. And when we ask them, what do you think is happening to contribute to these sustained gains a year later?
Yeah.
And they tell us they're so motivated by the improvements that they've seen, not just to their sexual function and distress, but to other facets of their life, mood, anxiety, ability to concentrate, that they're very motivated to keep practicing. And so the quick answer to your question is it works. It's easy but not simple, and the outcomes can be quite positive for a year later.
Yeah. And I would think it's one of those things if you don't come to mindfulness directly or you're busy, it's like I don't have time for that. But really you don't have time probably not to, given its impact not just on your desire and sexual wellness, but just about everywhere in your life, I would imagine.
Yeah, you're completely right, and that's usually the biggest barrier that we hear is, okay, it sounds great.
Yeah.
I'm convinced. I just don't have the time to sit down for even 15 minutes a day and do this practice. And because mindfulness is a practice, it's not a light switch, it's not a medication. One does have to put in the time and do the practice in order
And
to
make
gain
it
the
a
benefit.
habit.
And
Yeah.
and the perfect analogy is physical exercise, which is a different kind of practice, right?
Yeah.
We reap the gains when we put the time in, when we work our body, when we lift those weights, when we test our heart. That's where we reap the benefits. And mindfulness works exactly the same.
And when we think of, some barriers to sexual desire, sometimes they are the physical,
Yeah.
meaning women don't feel good about their physical bodies and they're maybe nervous in front of their husbands to be naked. Um, and so, but really probably at the core of that is just perspective and mindset, would you say?
Yeah, I mean, first of all, there's a whole host of physical changes that happen, not just in the body, but in hormones, in kind of our ability to sense pleasure, right? Like the pleasure receptors change, so things feel different over time. Body image is a significant issue that a lot of women struggle with, especially at midlife. it can be incredibly frustrating. And I often hear as a clinician, women say, I only undress in the dark, or I don't let my partner touch me anymore because I don't want them to touch the parts of the body that I'm so unhappy with. And even though my partner says that it doesn't matter to them,
Yeah.
to me it matters. And so all of these kinds of barriers can contribute to women being very judgmental of themselves when they're receiving intimate touch, regardless of whether their eyes are open or closed. So most definitely a method like mindfulness, which is it's not about distraction, it's about fully paying attention, but really bringing in that compassion and kindness, because it's really the negative judgment that contributes a lot to women's suffering, right? It's that kind of staying in that place of why me? Why won't things ever get better? Nothing I do is working. No doctor will help me. That contributes to the experience of suffering.
And so we talked a little bit about, the physical body and perspective on it. Are there other factors that you see with low desire, low libido among women of this age group that we can feel like we're not so alone with?
Oh goodness. Yeah, so many. I mean, let's talk about inattentiveness. And we know, a common experience among midlife women, and certainly during the perimenopause, is difficulties with attention and word finding problems. So there may be memory changes, there may be cognitive impairments. I mean, the number of women that say to me, "Oh, I feel like, I have early onset dementia because I keep forgetting things." And those are real changes. Those are documented real changes that a lot of women experience during the perimenopause. And so here is where, a mind attention training method like mindfulness is probably also contributing to some of the benefits that we see in sex, is through helping women focus. A lot of women, even non-perimenopausal women or non-midlife women, will say that their minds are elsewhere during sex. They're thinking about, what they need to do later on tomorrow, or did they
Yeah.
lock the front door? Did they turn off the oven?
That happened to me
Sometimes
just last night. I was like, the to-do list was running through my head. Like, I need to be more
Ah,
mindful. I need to
ah.
let this go and be present.
Yeah, I mean, I often say that, our bodies are having sex and our minds are not, right? And so mindfulness as a tool to align those,
Mhm.
it can be not just important. I have often argued it's essential for bringing those two together. If we contrast that to males, and we've tested this, many other groups have tested this in the lab. When you bring men in, you put a strain gauge around the penis, you show them some erotic films, and then you ask them how turned on they were. There's usually close alignment. As the body becomes aroused, the mind becomes aroused to the same degree. When we do the same with women with a vaginal probe that measures blood flow into the genital area, there's typically no agreement. And so
Oh,
the body
interesting.
might be showing physiological responsivity and the mind is not.
Oh,
And that
wow.
kind of desynchrony or discordance seems to be almost a feature of women's sexuality, an unfair feature, but so be it. And it does
Great.
mean, therefore, that methods that we can do to bring the mind back in alignment are going to be really important.
So even if there was like a long period of, foreplay and warm up, etc., if your mindset is not there, you will not be as aroused as a man would be in that situation. Is that right?
Yeah, that's right. And it's because the brain is the biggest sex organ,
Brain
not the
is the
vulva
biggest.
or the vagina, because it's the brain that's processing this information. It's the
Mhm.
brain that's extracting meaning out of the touch. It's the brain that's pulling up memories from past encounters, and also the brain that's anticipating the outcomes. Is this going to work? Is this not going to work? And so those brain factors, no, you could have the best stimulation in the world,
Yeah,
whether it's the best vibrator or the
yeah.
most attentive partner. If the brain is either not present, lost in judgment, or somewhere else into the future, it's not going to process all that information and produce arousal.
Mm. And within your research, have you explored into the women who feel like they don't have any desire at all, and does mindfulness help with that?
Yeah, so in our randomized trial, I would say that that was the majority of women who said, I remember a time
Yeah.
way back when I was motivated. I would initiate sex. I would spontaneously think about it during the day. And they can't quite put their finger on what the change was, but they now say, I never think about it. In fact, if I never had to have sex again, I could live with that. I would be fine. And oftentimes, sadly, what brings those women into treatment is a partner. So a
Partner.
partner being upset, or it's created some conflict in their relationship. And so they're motivated to improve their relationship, even though they may not be motivated to improve their own desire.
Mhm. So, I mean, in reality, if we are not sleeping well, we're disrupted sleep on top of that with night sweats, we've got brain fog, we've got a million things to do on our list, taking care of other people, mindfulness is really an essential tool to keep us sexually interested and active. Is that fair to say?
Yeah, I mean, yes to all of that. And mindfulness is not a panacea.
No, right, right, right.
It's not going to take an angry, belligerent partner and make them nice. It's not
Yeah.
going to reduce a to-do list, but it might help you, focus in on what's most important so you can make decisions, right?
Right,
So,
absolutely.
yeah,
But
I believe firmly, like so when we ask people to describe their most blissful, enjoyable sexual encounters,
hmm,
you hear hundreds of different stories of where they were, what they were doing, what kind of stimulation, but the commonality that you will always hear, I've certainly always heard, is something to the effect of, I was fully there, nothing else mattered. I was completely in sync with my partner. I was hanging on every sensation. So really, it's the experience of mindfulness that makes these blissful encounters what they were.
and yeah, so certainly not a panacea, but if it's a valuable tool in the toolkit, amazing to know, rounding out our exercise, our nutrition, and hormone therapy if it's right for you.
Yeah.
Um, and so for women listening to this and they're interested in starting in a place of mindfulness, do you have any tips of where they can start or what to do?
Yeah, I mean, thankfully, there's lots of apps that are out there that introduce people to mindfulness, and there's scientific evidence that even ten minutes a day, every day of a focused mindfulness practice can lead to some of those brain changes that then lead to improvements in different facets of health. So that's what I always recommend first is start doing a general mindfulness practice every day. And then in order to kind of take those skills and really adapt them to your sexual environment, it's one of the reasons I wrote my two books was to really walk people through, okay, now that you've got mindfulness skills, how do you incorporate them into either solo sexual pleasuring, or other body focused exercises, such as when you're having a bath or a shower, incorporating mindfulness into becoming aware of your body. And then gradually, how do you bring those into touching encounters with a partner, and then progressively more sexual encounters with a partner? So, again, I think starting out with just establish a practice, right? So if you're brand new to exercise, you're not going to run a marathon next month. You're going to start maybe with a couple of kilometers of walking, and then slowly build up from there. Because the mind is a muscle, we want to give it time to adapt. But the neuroimaging data are so unbelievable when in terms of the impact of mindfulness on the brain. It changes the structure of the brain. So you see branching in those parts of the brain that contribute to paying attention and kind of consolidating information. And you also see differences in brain function. So the parts of the brain that communicate to one another during different activities changes as a result of mindfulness practice.
Probably that introduction of compassion and rewiring your brain to think more compassionate about yourself is probably one of the key things that's really important. I'm guessing.
Yeah, yeah, it sure is. And then a lot less activation in the emotion center or the limbic area of the brain. So that because oftentimes when we're in distress, we're feeling extremes of irritability and sadness and anger and everything in between. And so you have a lot of activation in that limbic system of the brain that kind of dominates and impacts, the kinds of things you think and then the behaviors that we engage in. And that's why, our emotions can be so powerful for contributing to what we do and what we think, et cetera. And so one of the ways that mindfulness works is actually by quieting down that emotion center in the brain, and allowing us to be much more present just with sensations. So you see the part of the brain that contributes to feeling sensations in the body, something we call interoception. We see more activation in those centers and less activation in the emotion centers.
Oh, wow. Wow. And you touched on self-pleasure a little bit. How important is it for women to understand their own bodies and to be able to understand, what works for them and, how to have an orgasm in your research?
It is critical. It's absolutely critical. And I chuckle because, if you were to swap out men for women, I think men would simply laugh at that question, right? How important is it to know your body? Because, when we look at just differences based on anatomy, young boys become very, very aware of their genitals because they're external. So
Mhm.
they bump up against things. They have to be aware of them in sports. When they're having a bath or a shower, the water running on it makes them aware of pleasurable feelings. And we normalize all of this. In fact, we don't even think twice of it. And because for women, the pleasure center, the clitoris and the vulva are hidden, they're completely hidden. So it is a learning experience that women have to have. They don't accidentally, discover this. They have to intentionally discover this. And it's so important because, I mean, for so many reasons. First of all, there's a lot of societal myths that the vagina is the source of pleasure for women, and, women should be having an orgasm with penile vaginal intercourse, yet less than 20% of women
Yeah,
do. And then they think there's something wrong with them
right,
because they
right.
don't. And when they realize and when they learn that actually it's the vulva and the clitoris and the kind of underlying clitoral structures that contribute much more to pleasure, and then you give them permission and instruction to go and touch and explore. And then often what I hear from my patients is, why didn't someone empower me to do this,
Mhm.
years ago, years ago?
Yeah,
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 I think it's so important, Natalie.
yeah. I just, for personally, for women, particularly of this generation and demographic, being raised to, not ask for sex, not know their bodies. And I was at a recent talk and the physician spoke to some, not a direct quote, but say roughly 20% of women over 50 were sexually active, meaning they still have intercourse once a week. And he was sort of sharing that's great. And I was like, what the hell? Like we are supposed to be having less, children responsibilities. Our
Yeah,
careers supposed to be a little bit more stable. Like we should be having the best rip
that's
roaring
right.
sex of our lives.
That's right.
And we're stuck in these old patterns
Yeah,
of, not feeling desirable or not knowing how to have sexual pleasure because we haven't invested in ourselves or even know our anatomy
yeah,
really.
yeah,
Um, it's just very interesting. But
yeah,
we're on a
yeah.
mission. We're on a mission to,
We're on a
to
mission.
change
Yeah.
that.
And we want to empower our healthcare providers and family doctors with this information that actually there's pretty compelling data that show us that sexual satisfaction in the older years is highly correlated with measures of physical health.
Mm.
Right? So now what causes what here? Is it that being more satisfied in sex leads people to be healthier, or being healthier means that you have a better sex life? Regardless, this should be part of the aging well conversation that we have with our healthcare providers. Not just how do we control blood pressure and what
Yeah.
medications are we on, but how do we optimize sexual health in the older years, recognizing that there are physical changes and hormonal and physiological changes that happen, right? And there's things we can do to buffer against some of those changes, but we can't reverse aging. We can't reverse aging. So yeah, I mean, I think that's part of our call to action, is making sure that our healthcare providers are armed with this information too.
Yeah, it feels like such a huge gap, not just for sexual health, but for menopause care with providers having the education to know what to do or how to handle it. I feel like it's just a big call to reimagining what that physical exam looks like, to include sexual wellness, to include bone health, the whole gamut.
Yeah.
It feels like such a miss for women.
Yeah.
And so helping them to find access to care. I think sexual health is probably a pretty big one.
Yeah.
How do you get the confidence to ask your doctor about it and then to find out that it's maybe dismissed or it's just aging or whatever it might be?
Yeah, I mean, one way to do that for your listeners to this conversation is they can, say, go to their doctor and say, "Hey, I heard a conversation, I listened to a podcast, I read something, and I learned that sexual health is a part of quality of life. And
Mhm.
sexual health is part of the conversation with regards to health promotion and living well and longevity. And we haven't had that conversation to date, but I want to have that conversation with you now."
Yeah.
And don't accept being dismissed. And I realize that's a big statement because a lot of people don't have even a primary healthcare provider.
Mhm.
And so it may involve shopping around a little bit until you get the care and attention that you deserve.
And just switching lanes a little bit to more of the partner side of things, assuming that you're in a healthy, trusted relationship where you feel safe, what kind of role for a woman who's maybe too shy to, seek out sex or feels too shy to, what kind of advice or guidance, if any, that is evidence-based, around starting these conversations or anything to start the dialogue with your partner?
Yeah, excellent question. And this is another place where a lot of women struggle, especially women who've been in very long-term relationships and have never talked about sex to their partner. In fact, I see a lot of women who maybe have also had pain with sex and have never told a partner that sex hurts. They just
Right.
sort of, grin and bear it, and it's so sad to hear stories like that. So there's a couple of things to keep in mind. Number one, bring it up not in the bedroom. So, schedule it, maybe have a conversation about it when you're going for a walk. Use I language. So I have been thinking about sexuality. I have been reading more about it. I've been hearing more about it in podcasts or, wherever. And would love to have a conversation with you about it. So using I language is far less likely to put a partner on the defensive. Because if a
Right.
partner hears you're not doing this, or
Mhm.
you're not pleasuring me, or you're eliciting my pain, then they're just closed to having a conversation at all. The other thing I'll say, since you mentioned kind of the science and evidence-based data, there's definitive data that show us that sexual communication in a relationship is one of the predictors of long-term sexual satisfaction. So it's not how much sex you're having. It
Right.
is, are you talking about it?
Right.
Is a significant predictor. And so talking about it can be as simple as, how was that for you? Did you enjoy it?
Yeah.
All the way through to, can we have a conversation and explore ways of maybe being more experimental in our sex life? Or can we
Yeah.
go and shop for a vibrator together, right? So some people will feel comfortable with that, others won't. But communicating about sex turns out to be a really important way of preserving sexual satisfaction in the long term.
Yeah. And so maybe it's about finding a small, safer thing to raise in humor to get the confidence to get it going, whether it be, that kind of is starting to hurt me now,
Yeah.
that type of thing. And in terms of the pain, I mean, this I feel is such an issue. 70 to 80% of women will have genitourinary symptoms, syndrome of menopause. I always go to the acronym GSM, and then someone
Yeah.
asks me what it is, and I can't say it.
I know.
And with when there's dryness and pain, certainly vaginal estrogen is, uh, best practice for GSM. And there's also, great products on market to help with lubrication and pelvic floor physiotherapists and the gamut to help with that.
Yeah.
But again, we end up in this place where women have to have the confidence to seek out the help, find a provider who knows about it, and just wondering any observations or things you would add to that topic.
Yeah, you're absolutely right, and definitely perimenopause and postmenopause, because we actually know the GSM gets worse in the postmenopause, especially if it hasn't been adequately treated. So, unlike some of the other symptoms that women experience during the perimenopause, which get better in the
Right,
postmenopause,
right. Thank you for raising this.
GSM is not one of them. It actually can worsen over
Right,
time. So, having a physical exam by your physician is actually really important, because there can also be some other contributors to the pain. There,
right.
there could be a vulvodynia, there could be a lichen sclerosis, which is a skin condition, there could be
Mm.
bacterial vaginosis, there can be other things. So, in addition to or separate from the GSM that happens with peri and postmenopause. So having an exam is really, really important. And I think that would be step one. And then on the basis of that, having a conversation with your healthcare provider around, once you have a diagnosis, is asking for what are the evidence-based treatments for this. And I always recommend that women um, do a bit of their own reading ahead of time as well,
Yeah.
so that you can read the Menopause Society guidelines online, or the Canadian Menopause Society guidelines online. Those are free access in the public domain. Anyone can print those off. They're updated. And it's pretty clear in there what if it is GSM, what the treatments are. We also want to emphasize the importance of lubricants. So lubricants is not the same as a vaginal estrogen or a moisturizer. It goes on the outside, and it's intended to make sexual touch more comfortable. And we recommend a lubricant during all sexual encounters. So whether it's masturbation or
Right.
intercourse with a partner, it's intended to make sex more comfortable, but it won't necessarily address the pain. So for a lot of women, those two are used in combination. So a lubricant plus a moisturizer, which is either prescription or non-prescription. So just having a very matter-of-fact conversation with your physician, make sure you get that exam done to rule out other explanations for pain.
Yeah. So if I'm just to sort of summarize, it's, you know, GSM is likely to get worse, not the same or go away like some other
Right.
menopause symptoms. Seek out a provider to rule out that it is not something else,
Yeah.
and, seek out treatment for it.
Yeah.
Gold standard being that vaginal estrogen, but,
Yeah.
and then though other products like lubricants are really, really important
Yeah.
to support a positive sexual experience.
Yeah.
I get
Yeah. And
it.
just remember, sex shouldn't hurt.
Sex should never
That
hurt.
that's another kind of stereotypic message that women grow up with
Yeah.
is, yeah, sex hurts. There's going to be blood. There's going to be, pain. Sex should not hurt. If it hurts, something is not right and needs to be investigated. And that's the case whether you're 65, 45, or 25 years old. If it hurts, something is going on and needs attention.
Women, sex should not hurt, and peeing your pants is never okay. That's something else
Right.
I learned, not related to this interview, but a little bit maybe.
Yeah. Public
Well,
service announcement, right?
yeah,
All of the things that we need to undo in the
yes,
messages that we've heard.
yes. Well, thank you so much. Is there anything that you feel is important for the audience to know that maybe we haven't touched on?
This topic can be challenging for some people. If you grew up in a culture or environment that taught you that talking about sex is wrong or dirty, I just want to acknowledge that this can be a difficult conversation to think about and have. And thinking about sex as part of your health might help. So rather than it's this dirty thing that people do and never talk about, looking at sexual health as a component of health might help to be able to have these kinds of difficult conversations.
Well, and I think, your time today is so important because I think the more as women we openly talk about it and openly see it, it helps to move the mark. So
Yeah.
thank you. I really appreciate it.
Yeah. Thank you for the opportunity.
Thank you. We'll talk soon.